breaking the wall to climate-resilient health. Maryam Bello, Parker's Mobile Clinic, Nigeria.
2.3 million. 2.3 million. These are not just mere numbers. These are the numbers of people and families that have constantly suffered the harsh realities of climate change in the whole of West Africa in 2024 alone. In the past 5 years, my healthcare initiative in Nigeria has consistently borne witness to the heart-wrenching consequences of climate change on our society's well-being. In October 2022, an 8-year-old boy called Izuchukwu tragically lost his life when a surging flood flushed him into a deep gully erosion in southeastern Nigeria. His 2-year-old sibling, who was critically injured, almost lost his life because it took forever to get access to basic medical help. Now, these are just the two stories of the 2.3 million people, of which 80% consistently lack access to medical help during these disasters. I am Maryam Bello, and I'm the co-founder of Parker's Resilient Health. In order to promote urban and rural resilience in healthcare, we introduced 3 components of science by developing an AI-driven telemedicine platform which enables remote access to medical help, bridging the gaps even when roads are flooded. And this happens in one simple step. Our target beneficiaries go on our telemedicine platform, and then they book a consultation with our healthcare professional and have a consultation on professional injury management and primary healthcare. Then, we leverage our mobile clinics during these disasters to provide emergency triage and guidance. And with the integration of advanced electronic health record system into our approach, we collect patient data such as environmental exposure, leverage their historical data to provide resilient healthcare in the future. Our target beneficiaries include women, children, elderly and chronically ill people, people from underserved communities, and persons living with disability. Since the inception of the Parker's Resilient Health Project, we've made substantial strides in improving the healthcare outcomes of people living in flood-prone regions, of which 70% of our target beneficiaries are women and children. And we've also been able to impact the lives of over 100,000 people across 10 communities with 24 targeted health outreaches in terms of primary health care, emergency triage and guidance, and also so many other interventions. And we've been able to garner over 13 global awards, and we've been able to raise $200,000 plus to scale our impact. And beyond immediate impact, we've also been able to unite and train over 50+ healthcare workers with co-creation and community leaders, ensuring sustainability of our impact and ripple effects and ensuring feasibility of impact as well. And partnerships and collaboration have also been integral in our approach, as co-creation and partnerships with organizations like the United Nations Development Programme, Hikma Health, Anambra State Ministry of Health, Vitamin Angels, and so much more has enabled us to integrate advanced approaches into our approach. So, before the integration of technology into our approach, we were just limited to 2 communities. But now we've been able to scale into 10 communities. And we also just very recently realized that regardless of everything we do, these communities need and deserve a standard healthcare facility, which is the reason why we are currently developing a healthcare facility at the heart of Anambra State, Nigeria. So as we stand at the intersection of technology, innovation, and sustainability, why don't we join our hands together to promote resilient healthcare for these 2.3 million people and the children to come? Thank you. Thank you. Thank you.
Well done.
Thank you.
It's not easy to be the first one. Any questions? Yes, we have a question here.
So, thank you. That was fantastic. How do you engage the local communities, and what has been the reaction?
Okay, so I don't know this. So I talked about leveraging our mobile clinic for emergency triage, and we also leveraged this mobile clinic, which is in the first image, to go for outreaches to these communities. We've had so many outreaches, 24 is the number here, but we've had a lot of outreach on so many health intervention to ensure that we engage community leaders as well to gather our target audience. And yeah.
Sorry, just one more question. What have been some of the hesitancies that you've had to overcome? Like, what have people said to you? Like, have there been problems that you've had to say to them, actually, no, don't worry about this? What have been some of the reactions?
Thank you for that question. So this brings me to some of the challenges that we experienced. First is the aspect of insecurity, right? Your question is, just to be certain, right? What are some of the challenges we experienced, right?
Challenges, yeah. What have been some of the things that people have hesitated to come to you or
Okay.
stop them coming to you?
Okay, yes. So as I said, insecurity has been a challenge, right? But then, because we wanted to scale and we found technology as a means to also streamline our approach, we had people not understand the value of technology in terms of for having this online consultations. And so in order to solve this, we had a couple of training sessions, not just for the community members, but also our health workers, because also it's in Nigeria, Africa as well, technology is like a barrier. So we also had to conduct a lot of trainings in order for us to address these challenges. And then okay.
Another yeah, here, please. Microphone? Oh, you want that?
Yeah. So I just want to ask a follow-up question on that. How do you address the issue of access in terms of technology? Because your whole ship runs on people being able to access you over the internet. So
Yes.
how do you address that?
Yeah, so accessibility isn't just only on the internet, like I said. We also have outreaches, yes, but then we constantly host workshops. We constantly have outreaches, like I said. And so the training and showing people the value of technology for their health is one of the things that we leverage. So yes, training people has been one of our integral approach.
And I think it's the end of the question time. Thank you very much.
Thank you.
You don't.
Thank you.